So you finished physical therapy and you are ready to get back to real life. But in the back of your mind, are you thinking, oh, what if that injury comes back? Here are 3 tips for bridging that gap between physical therapy and getting back to everyday life with greater confidence. First, turn muscle isolation into movements with meaning. Physical therapy is great at identifying the weak links in a movement chain and give you exercises and things to do to heal that part of the body. But because your body gets stronger in the specific ways that you exercise, make sure the movements that you're doing now incorporate the movements that you want to be able to do in everyday life. Those movements have 3 categories. There's mobility, there's strength, and there's stamina. Oftentimes, injuries happen from an imbalance of these 3 types. As you're transitioning from physical therapy, take a look at now, how do you make sure you have a balance of exercises for mobility, for strength, and stamina that are the movements that you want and need to do in everyday life. Second, this is the time to initiate that whole person healing. When you have an injury, your brain identifies that part of your body as a problem and it protects it. It's a helpful part of healing so you don't continue to re-injure that part of your body. But part of healing is calming the fears about that. And that doesn't happen by thinking differently. It also happens by moving differently and then mindfully being aware that you can move without pain. So that when you're moving in everyday life, you're doing so without fear of re-injury, but with whole person confidence. So think about the movements that you're most nervous about doing and break them down into their smallest parts, finding the way to do them with confidence. So if you're nervous about picking something up, practice bending down and squatting and hinging so you can do that movement using the strength that you have rebuilt, and then gradually build into doing that movement with full confidence without worry about injury in that part of your body. And the third step is to turn what the physical therapist gave you to continue practicing into a well habit. Our body is a use it to keep it system. So take the exercises that you're supposed to continue doing, and rather than turning them into some rote habit that's just a should, a task on a to-do list, make it a well habit, something that you're intentionally doing for your well-being. Keeping these exercises from becoming a should on your to-do list by connecting the time investment in exercising to maintain your strength, stamina, and mobility with feeling and functioning your best with full confidence again, right now and in the future.